Welcome to Baptist Health Talk, powered by the NAACP, dedicated to improving the health of the Black community through education and empowerment. Hear from Baptist health experts as well as community leaders about what you can do to improve the health and wellness of your family. Whether it's diabetes, heart health, or better nutrition, Baptist Health Talk aims to promote positive change in Black health outcomes.
Hi, everyone. I'm Dr. Yvonne Johnson, Chief Medical Officer at South Miami Hospital, coming to you from the Baptist Health Newsroom. We'd like to welcome you to this collaboration with the NAACP to have frank discussions about improving the health in the Black community. Recent data have continued to show that heart disease is the #1 killer for all United States adults, and stroke is the #5 killer, as well as the leading cause of disability. As frightening as those statistics are, the risks of getting those diseases are even higher for Black people. Here to talk about heart health and the Black community, we are joined by Dr. Marcus St. John, Interventional Cardiologist and Medical Director of Baptist Health Miami Cardiac and Vascular Institute, Cardiac Catheterization Lab, as well as Harold Ford, President of the South Dade branch of the NAACP. Thank you both for being here today.
Thank you. It's my pleasure.
Before we start our conversation, I wanted to take a moment to talk about this collaboration, this project that Baptist Health and the NAACP are embarking on today. We want this to be a collaboration, a conversation with diverse range of guests, including members of the health team at Baptist and our various partner community organizations, all to encourage listeners to be aware of the health-related illnesses affecting people of color in our community. Mr. Ford?
And thank Baptist Health Systems for actually being inviting to this conversation. And we definitely welcome the opportunity through various initiatives that we do through the NAACP, not only just advocacy work, but we also have, we have a number of initiatives that we do get involved in, and this is just one of them, dealing with the health issues that we face as Black people, and more importantly, advocacy for the care of those individuals who suffered various health challenges.
Absolutely. And I know, Dr. St. John, you have been an advocate for health in our community, particularly heart health. So how is this impacting that aspect of your practice?
Absolutely. And thank you, Dr. Johnson. It's a pleasure to be here. So as Mr. Ford said, we are also very excited about this partnership and opportunity to educate and inform a diverse range of consumers and hopefully the Black community in general. Dr. Johnson and I are both members of the Physicians Business Resource Group, which is one of the ways that Baptist Health is trying to increase awareness among diverse communities of the importance of equity and inclusion. So we are participating in this project in collaboration with the Black Business Group as well. So it's a pleasure to be here, and I think this inaugural discussion will set the tone for many more discussions to come.
Thank you both for being here. So let's get started. So we know that heart disease is the #1 killer, as we said, of the community in general in the United States, but disproportionately affects the Black community. And what I have seen in the emergency department is that the risk factors that go into heart disease, that affect heart disease, a lot of people in our community don't necessarily even know that they suffer from those risk factors. You know, when I worked in the emergency department, people would come in and get diagnosed with an acute heart attack. And when you ask, do you have a history of high blood pressure or diabetes or high cholesterol? Many of the times, people were not aware of that at all. You know, I used to joke that they belong to the don't ask, don't tell club. How have you seen that impact your practice or what you've found?
We see this every day, Dr. Johnson. And, as I tell patients and the community in general, another way that it's very important for people to know their risk factors is really by what we call knowing your numbers. And historically, that has meant going to a doctor, getting an appointment, waiting in line. these days it is easier for people to access that information. And I think that's really important in democratizing access to knowledge about your health. So people can very often go to an urgent care, they can go to a local store and buy a blood pressure cuff. There are many devices that people can wear that gives them information about heart rate and blood pressure and even oxygen level. And people can even actually check their own blood sugar. So knowing your numbers is critical, and these days it is easier. And I think we just have to educate and empower people as to the importance of knowing their numbers and helping them find out the myriad of locations where they can get access to that data. So I see every day, as you mentioned, Dr. Johnson, I'm thinking of a person just yesterday that I treated. Oh, I have no health problems. Well, when's the last time you saw a doctor or got a checkup? Oh, about 4 years ago. So, you don't have health problems because you never gave yourself the chance to be diagnosed. So I think that is one area that we have a lot of work to do on to help people feel comfortable accessing care and show them the ways and the places that they can do that.
Yeah. So, we know that February is Go Red Month. That's what I'm promoting here. It's the month that we recognize as Heart Disease Awareness Month. Are there anything going on in the community that is promoting that awareness?
Well,
Mr.
through
Ford?
the NAACP, we are consistently advocating, awareness about various issues, and we are definitely encourage people to listen to your body. Something seems odd or awry, it's definitely, we encourage people to go and get themselves checked out. Because again, you don't know what's going on if you don't give your chance of self to be, as Dr. St. John said, diagnosed. So listen to your body. I don't care if it's, you pricking your finger or whatever the case may be. Get it checked out because you don't know what underlying issues. And as I've been told, and you guys can confirm, by the time you get to the emergency room, it could be a much worse situation that could have been preventable. So through the NAACP, in our advocacy work, we always advocate for people to be proactive in their health and not reactive.
Right. So, we kind of talked about a couple of the risk factors, hypertension being one of them, and we know that hypertension disproportionately affects members of the African American community. What do you see as some of the barriers to members of our community getting that access to care? Because, that is really what we have seen, is that there does seem to be a lack of a regular awareness of being regularly checked. And particularly when you get to someone, like me in the emergency department, like you said, that really is not where you want to find out that you had high blood or that you have high blood pressure. That's not where you want to find out that you have diabetes or high cholesterol. But it seems like there are some barriers to care, and we certainly saw a lot of that during the COVID pandemic, where undiagnosed and untreated or poorly treated illnesses, chronic illnesses, seem to plague our community.
Well, part of it is, I think, and what I've learned is, sometimes we take certain things for granted. Me being a former athlete, not realizing the days that I was doing my athletics, that I felt that, hey, my health was at its best, and not realizing that even though you may feel a certain way, internally, your body could be making certain changes that you're unaware of. And I think part of it is a false sense of reality. Now, the other piece to it is there's an economic piece. Where some people don't have insurance. Some people don't think they can afford to go. So they will go up, wait until the very last minute, and sometimes, God forbid, it could be too late. So we have economic barriers. We have concerns as far as access to insurance. And then, one of the other pieces of this puzzle, I think, is also confidence in this system, because there's been some issues historically that have not boded well for Black people, which is why many are apprehensive to go get themselves checked out when they really need to get themselves checked out.
There's a trust factor, you're saying. Yes. And I think we certainly saw that in the COVID pandemic, where people were asked to trust in a lot of research that was going on with new treatments that that there was a lot of hesitancy with that. So, and do you see that same kind of hesitancy in your practice, Dr.
Yeah,
John?
we do for sure, Dr. Johnson, and all of the comments Mr. Ford is making certainly resonate with me. And I think one of the additional values, in addition just to our expertise that Dr. Johnson and I bring to the table as Black physicians, is that imparts an innate sense of additional trust that I often see in some of my patients who often seek me out, not just for expertise, but a sense that I will be able to relate to their condition. And I think the evidence supports that people access care more readily and have better outcomes if they can be treated by physicians with whom they feel comfortable. And sometimes some of that comfort is race-based. For better or worse. And I think some of the historic issues that you referenced still sort of plague many of our communities. And I think it's important to address it. And this is not casting blame. It is acknowledging that a problem existed and that we are taking steps to welcome everyone into the fold of medical care and meeting them where they are. And I think medical care, Dr. Johnson, doesn't always have to be in a doctor's office. So maybe it's a mobile van that checks blood pressure where people are. Maybe it's an outreach event after Mass on Sunday. There are a lot of places where people may feel more comfortable or congregate more commonly that we can at least make the initial contact and then set up follow-up when it's needed.
Yeah, and I can imagine that the NAACP does some research, some outreach into the community where offering health screenings.
Correct. Yeah. Yes, we partner with a number of organizations so that we can do, again, health screenings with health fairs and different types of event, whether it's specified to a specific ailment or type of screening, or we're doing just a general, hey, come in for high blood pressure, let me test your glucose, etc. So we do a number of partnerships throughout the community to encourage people to go out and get themselves checked out.
Okay. So, we kind of talked a little bit about high blood pressure. What are some of the other risk factors that people should be aware of that could lead to heart disease?
Yeah, high blood pressure is definitely up there as one of the big risk factors, also a very big risk factor for strokes. When we talk about cardiovascular disease, we're really focusing on heart attack and stroke. And high blood pressure has so many additional impacts. It's a big factor in development of renal failure, blindness, and other things. So in discussing with patients, I often try to choose whatever thing they are most worried about to sort of highlight the importance of addressing the risk factor, because many of these risk factors can sometimes feel like these sort of nebulous terms that don't really have any impact. So high blood pressure, for instance, hypertension is called a silent killer because many people don't have symptoms until they have an event. So it's trying to motivate people by things that are of concern to them, even when they feel good, and help them realize the importance of taking action. So high blood pressure is a big one. Diabetes is another very big one. Again, most commonly needs to be diagnosed by a lab test. If you diagnose it by symptoms, you're already way far gone. Smoking is another one, and high cholesterol. I think those are the big four, and then there are several others, sedentary lifestyle, obesity. These all play into some of these additional primary risk factors. And then we can get into other sort of systemic stress is another big factor in general, poor quality sleep. There are even studies on structural racism as a actual risk factor. So there are many factors, but the big ones are smoking, cholesterol, blood pressure, and blood sugar for sure.
And I think the important thing that you mentioned with those diseases is that a lot of them are modifiable.
Absolutely.
And particularly things like smoking. None of us are born smoking. We might be born with a family history for a propensity to certain illnesses, but we're not born smoking. So, that is something that we can choose to stop doing. The sedentary lifestyle, we can get up and get out and start walking. You don't really need a lot of equipment or any organization really to just get up and start walking. But, are there programs that the NAACP or other community partners of yours do that the community should know about that can help with some of these risk factors that Dr. St. John talked about?
Most definitely. One of the things that we're focused on now is trying to minimize and eliminate food deserts, because we know that nutrition plays a large part in what we do. And
Absolutely.
So we have a number of our communities. For example, when I look at my zip code where I live, I don't have a grocery store in my zip code. Yeah. So where I have to drive, a large distance, or not a long distance, but a long distance pretty much to get whatever I need for my family, so that we can consume those things. So food deserts, and we have some community gardens that are going up in various communities that we definitely service here in the South Dade community. So that's pretty much where we're starting our efforts, in addition to promoting that healthy lifestyle. And myself, I've, along with a group, we started walking on weekends, to get this ball rolling. So we invite anyone, if you're at Goulds Park on any Saturday morning, 6:30, we're there sharp to try to go ahead, again, and improve the health, not just of ourselves, but anyone who's interested in being a part of that cohort.
Yeah, that's awesome. And, both of you mentioned this idea of different types of disparities and risk factors that are community-based, like, not having access to nutrition. And, you're able to drive to somewhere where you can shop,
Right.
but I can imagine that there are people in the community that don't have the ability to drive. And I think those are some of the factors that we need to recognize and that we really want to highlight. And it is something that we are looking at Baptist Health. Yeah. Now when you come into our hospitals for whatever you come into for, we are taking stock of whether you have risk factors like food insecurity or housing insecurity. Awesome. So that we can address those, because we understand that that is a big influence on your health. That, while most of our focus historically as physicians has been on those numbers that Dr. St. John talked about, what is your blood pressure, what is your sugar, what is your cholesterol. But if when you go home, you don't have access to healthy food or feel like, you're not safe in your home or your environment, you're not likely to get up and out and just kind of walk the neighborhood if you're not feeling safe. So I think we are starting now to really address some of those other factors that impact health. Yeah. We find that really the pure medicine part is a small fraction of what impacts our health.
If I can add something to that, Dr. Johnson, or to dovetail on that, I think what we're talking about and Baptist Health is starting to measure are these health-related social needs. And I think this is an important focus because it takes some of the burden just away from the individual. So some of these things are at a community level. So where you live will impact your ability to walk safely at night, or to go to a grocery store, or to not have a grocery store. Where you live sort of impacts whether you're going to get bystander CPR, and we can talk about that also. So some of the solutions are not just telling people you need to work harder and do this or do that. Some of the solutions are our communities and our elected leaders understanding that we have to level the playing field when it comes to different zip codes and educational opportunities and safe walking places and food deserts. And I think that is important so that people are not left feeling that all of their challenges are their fault and that only they can be the solution. There are a lot of things that I think communities have to do to help people get best access to care and be the healthiest version of themselves possible.
And I think that's where collaboration like this with a community-based organization like the NAACP and the trust, frankly, that you have with the Black community, I think that's where these kind of partnerships are most vital and impactful, where you can have the physicians who can give credence to the importance of reducing these risk factors or addressing these risk factors, but also having a tie to that community that's a trusted partner that gives some credibility to the message. So, definitely appreciate this forum. And Dr. St. John, I know you're very passionate about the health side that people can impact, the nutrition, the exercise, the healthy lifestyle piece. You've written about it. You have chaired the Heart Walk in the past. So, what more can you add in terms of how nutrition impacts heart disease and the risk factors for heart disease, and your take on exercise and what that can bring?
Yeah. So I think all of the things we've talked about sort of play into that. So I am very involved in the American Heart Association. I'm the local board president, and one of the things that we do is sort of try to reach into communities. To the mission statement is to bring a world of longer, healthier lives. So more birthdays, more anniversaries, more of these things that people care about. So reaching into communities and educating and empowering people to take steps to improve their lives. So much of it is nutrition-based. Much of the food that's available in food deserts is fast food that is extremely high in saturated fats and sugars and salt. So helping people understand those very basic things that we take for granted. And I'm constantly surprised by what opportunities there are to educate people. So some people don't understand that a diet high in sodium can actually increase blood pressure, especially in African Americans. So there are a lot of opportunities for nutrition education and empowerment of people to understand, well, how do you read a label? What does it mean when it says healthy on the front, but everything on the back, it's these long words and chemical terms. So I think very basic things that we can do to educate people. And then the notion of exercise that Dr. Johnson mentioned, it is not about joining a gym. It's about putting on comfortable walking shoes and walking more. It can be that simple. It doesn't have to only be that, but I think those types of things. And then the sort of the low-hanging fruit, helping people to get off of their addictions to cigarette smoking, for some people alcohol. So those are the types of concrete steps that if we can educate and meet people where they are and bring that awareness, I think a lot of people can do a lot better without a whole lot of intervention. So none of what I'm talking about requires necessarily a visit to the doctor or to the nurse, but it does mean sort of learning what are the things that can impact your health.
Yeah. It's funny as you talk about exercise and even the power of something like just walking. A lot of times people would ask me, well, so, what's really the best exercise? I hear swimming is really the best thing. It exercises everything. And, and my answer is the best exercise is the one that you're going to do. Yeah. Because it really doesn't matter what swimming does for you.
That's right.
If you don't want to get your hair wet. And you're not going to swim.
Yeah, I love it.
So really it's about what is the one that you are going to do? What is it that you like to do? And figuring that out, because it makes it a whole lot easier to get out and do something that you really enjoy, that works for you. So I mentioned that I was wearing the red dress for heart disease. There actually has been, the American Heart Association has had a red dress campaign because we know that women suffer from heart disease at the same rates that men do. But in fact, I learned that after a first heart attack, women actually have a higher mortality rate. They die after a first heart attack more often than men do. And it really was a big part of the American Heart Association's campaign that taught people like me, physicians, that women suffer from heart disease, because for many of us, not just in the lay community, not just out in the community, but for even those of us who were physicians, we looked at women who would come into an emergency room with chest pain as, oh, it's probably indigestion. Or we didn't understand that things like back pain could be a sign of heart disease in a woman. Or something, you have jaw pain, or you're just short of breath, or you're just overwhelmingly fatigued.
Yeah.
Because who among us
Right.
isn't tired, particularly women, I'll say. But, so it was hard to, get to the point of understanding that when a woman came in with those complaints, that we needed to take them seriously, that it might be a heart attack. And even equally important was getting women to understand that when they felt that fatigue or that indigestion or that just shortness of breath or that back pain, that might indeed be heart disease. Have you seen an impact in what you do at the Miami Cardiovascular Institute and how women are treated and how women are the interventions that women get? Because I know once upon a time, women were getting much less in terms of intervention and treatment for heart disease.
I think the needle is finally shifting, because I think it has been years now that this awareness that heart disease may present differently in women in all the ways that you just articulated. I always tell people that the most common manifestation is chest pain or tightness or shortness of breath. And even those manifestations are still most common in women. But women are more likely to have less common presentations, the ones that you just articulated: fatigue, shortness, just tiredness, sometimes back pain, neck pain, jaw pain. So those are ones that when women in particular present with the less classic pain, I do think our emergency room colleagues and cardiologists have finally gotten the message that all patients, and women in particular, need to be taken seriously. And some of the testing that we do is very sensitive, so we can pick up early signs of things that we might not have been able to pick up earlier. And in the cath lab, we are also treating women at equal rates. Sometimes, if the arteries are smaller, women may be less likely necessarily to get stents. And then sometimes we also see different manifestations of heart disease in the arteries. But aggressive medical management is going to be important in both genders, and we certainly don't want women to be left behind.
Absolutely. And, I definitely have seen that there's more awareness. I'm not sure that the data show that we've been as successful as we'd like to be, but I definitely see that there's more awareness. So, Mr. Ford, can you talk a little bit, more about any of the programming that you do that you see that Baptists can, collaborate with, and how do you see this this partnership with some of the programs that you're doing in the community?
Well, first of all, again, thank you again, Baptist Health Systems, for just the willingness to engage in this opportunity. And there are a number of programs that we can do, because again, not only are we looking at just the physical health, and I know today we're talking about physical, but we have mental, emotional, and other health objectives that we have in trying to communicate to the community the importance that body that they're walking in is a very complex, organism. And it's going to take a comprehensive approach to really maintaining and managing it, over time to get the full life expectancy or essence of what God may have for us. So through the NAACP, like I said, we have a number of health initiatives that we deal with, dealing with a number of issues. We spoke a little bit about, sickle cell earlier. We spoke a little bit about mental health and things of that nature. So definitely through this partnership, we're looking to tackle a lot of those areas and advocate to the community what needs to be done so that they can take care of themselves. Because I often say, no one can take better care of you than you. And if you do the right thing, then definitely it'll make it easier on everyone else and their need of you at some point in time as we move forward. So through the NAACP, like I said, I can promise there's a number of things on our radar, and preferably through this arrangement, through this partnership, we can make those things happen and engage our community to the maximum that we could possibly do.
Well, we definitely look forward to continuing with that collaboration. This has been a great conversation. Thank you for sharing that insight. with our audience. And remember, viewers, be sure to download this and our other Baptist Health podcasts to keep up with the latest health and wellness information, emphasis on wellness, and tips from our experts. So thank you both for joining us, and we look forward to continuing our collaboration.
Yes, thank you. God bless.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk NAACP edition is brought to you by Baptist Health, the warmer side of care.